Great. Our next speaker is going to be Dr. Doroteo, who's Program Director for the Southeast Asia Tobacco Control Alliance. He's involved in the WHO Framework Convention on Tobacco Control that Dr. Erickson just mentioned. And he founded the FCTC Alliance in the Philippines. He has expertise in tobacco taxation, tobacco industry interference, smoke-free environments, advertising bans, and packaging and labeling. Please welcome Dr. Doroteo.
Thank you very much, Greta, and thanks also for having me. I'll be sharing with you some of the examples from our region, which is Southeast Asia, which is the 10 countries in that region, the Association of Southeast Asian Nations. But there's a beginning example first from Guam, which you all heard this morning from Dr. Palafox, is one of the U.S. territories. I'd just like to, I guess, preach to the crowd here about tobacco and cancer. This is a compilation of the relative risks of the different cancers associated with smoking. And as you see, there's more than just lung cancer, and breast cancer has even been implicated. I think this just drives home the point that if we want to do a lot of prevention of many of these cancers, we really do need to do a lot of tobacco control. The key lessons that I'll be speaking on are that number one, as Mike mentioned, political leadership is critical for success in tobacco control. Second, that we do need local data, even though there is sufficient data already showing the effects of tobacco use and disease, and that partnerships are essential for tobacco control to succeed, that we need to harness the power of social media to be cost effective where we don't have enough resources for the large media campaigns that were described by Mike, and also to anticipate the tobacco industry at every step, you know, where Mike talks about regulating the tobacco industry at every step of the life cycle of tobacco. The tobacco industry is already prepared to interfere. So very specific examples I'll be presenting. First on Guam, as I mentioned. Second on my country, the Philippines, where we had a recent tax reform specific to tobacco and alcohol. And then third on Cambodia, and again back to the Philippines to show you some of the problems we've faced with the tobacco industry and how that's actually delayed a lot of the tobacco control measures. So Guam's example is related to the under-resourcing of what we would consider as cancer control and prevention. Guam passed an anti-cancer tax in 2010, and this was just based on the opportunity where a senator had filed a bill to raise tax by 50 cents a pack. But at the end of the campaign, the result was that taxes were increased by $2 per pack. Many of you may not be aware, or you may be aware, this was the largest single tax increase in US history at that time, and maybe still is. And what is also very striking here is 15% of the revenues from that tax increase went into funding the Guam Cancer Trust Fund, with an additional 1% going to fund the Guam Cancer Registry. 72% then went into the Health Futures Fund, which is a US-wide fund, but focusing on the risk factors, including tobacco, alcohol, and drug use. So this was the first time that a tobacco tax was actually linked to sustainable funding for healthcare and prevention on the island of Guam. The paper that is cited actually cites a two-pronged tactical approach, which is working with the legislators on drafting the legislation, and second also is mobilizing the wider community to support that legislation. Two critical groups were also identified. One was the health community. There were doctors particularly who would appear during public hearings to support the tax increase, and then, of course, cancer patients and their families who made the stories, their life stories, compelling reasons to pass the tax increase. They gave the human face to the campaign, and I think that's really important because you'll see this also happen in the Philippines where I work. So this is a photo of when our president signed that monumental tax reform law. Behind him stands the Secretary of Health, and then a lot of the physicians who were involved with the campaign. And in the front, sitting with the president, are senators and congressmen, as well as some of the secretaries, the Secretary of Finance and the Commissioner for Internal Revenue. This was a really, really big campaign and a very huge success because the reforms were attempted for 20 years, in the making, and we finally got it in place. What's in that law? Well, basically, you can see here that we started out with 4 different tax tiers. And I'm not going to bore you with the details, but it just shows that we had a very large increase from the very low-priced, low-taxed cigarettes, which went up quite drastically, and then we have a slow increase over the next 5 years. That large increase, that initial large increase, was what worried the tobacco industry so much. They said that they would, shut down, and so many people would lose their jobs, and farmers would starve to death. Okay, so that didn't happen. Okay, but what happened was the law also included some earmarking for health, similar to what happened in Guam. 80% of the revenues from the tax increase went into funding our health insurance program. And I'll show you the numbers who benefited from this tax increase in terms of health insurance premiums. Some of the funding also went towards attainment of the MDGs, health awareness programs, and then 20% would go into medical assistance and health facilities enhancement. So it's a very broad range of health purposes that this sin tax increase would fund. When the tax was actually collected, the Ministry of Finance, the Department of Finance, was very happy because their revenues increased by more than double, even surpassed the targeted revenue goal. And you can see that in blue. There was a big spike from 2012 to 2013, and then a smaller increase to 2014. At the same time, the removals, which is how many packs are removed from the manufacturing facility of tobacco companies every year, that has declined significantly since the tax increase. As Mike mentioned, the tax increase is usually much larger. The tax revenue increase is much larger than the decline in consumption. So the tobacco industry is alive and well, fortunately for them, but not as dead as we would want them to be. The next win, of course, in terms of the national economy here, is that the excise revenue collections spiked enough to bring it back to the level of 2000, so 13, 14 years on the decline, and then jumping back up to the year 2000 levels as a percentage of GDP. And as a middle income country, I think that's really good news. Our Department of Health was also very happy. Their budget more than doubled over the past couple of years. And this is the largest budget they've ever had in Philippine history. They actually are being told that they're underspending. And since they're not used to having this much money, they don't really know what to do with it. Of course, if they asked civil society, we would know what to do with it. And then, of course, in terms of health insurance premiums, you can see here that in 2012, 2013, we had 5 million families enrolled. And since the health insurance premiums began to be covered by the sin tax revenues, that's jumped to 14.7 million families. So that covers about 70% of the population. So it's a huge jump. Of course, there are now birthing pains as to how people get access to quality health care. So it wasn't all very easy. This is a cartoon that came out soon after the law was passed. We did make it, but it was a very, very big struggle. You see from the top picture, this is a photo from our Senate hearing, and it was jam-packed. We've never had a health bill in Congress with this many people actually attending. And half the room is pro-health, the other half is the tobacco industry. So the industry argued about how the government would not collect revenues because of declines in consumption. So they were saying, wow, this will be horrible for the tobacco industry because so many people will quit smoking. Our farmers would be jobless. There would be more illicit trade. This is the usual argument when taxes go up. Even our poor, they're starving already. Their only luxury in life is having their cigarette, and you're going to take that away from them. Increase in unemployment, and then, of course, destroying the whole tobacco industry. We got all these from them, but this is not actually my slide. This is the Department of Finance slide, which they said they were able to refute. So we're not having health people actually refute the tobacco industry. It's finance people speaking on behalf of the health sector. And I thought that was really, really important. These are Philip Morris labor union employees saying no to the sin tax. So we had farmers and labor people on the street outside of Congress. We also had columnists writing on behalf of the tobacco industry. It's really too small to read, but the point here is that if you compare whole paragraphs, whole sentences and paragraphs, they're actually verbatim copies in each of these 4 columns. And you wonder how an unpaid columnist would actually say the same thing that another columnist would be writing. Supposedly, they never even talk to each other. So obviously, someone was feeding them information, and whether that came with an envelope or not, leave it up to you. So in addition to those op-eds, we found that very few articles came out supporting the sin tax reform, whereas those that were pro-tobacco really outnumbered the pro-health articles. And this was an infographic that we put out, some of our advocates put out on Facebook and other social media outlets to identify this issue. And some of the press actually said, no, this wasn't intentional, but if you look at the figures, it really is a huge problem. So we sort of had a media blackout in terms of the pro-health side. So we couldn't penetrate the mass media, and we had to focus on our social media. Dr. Palfox mentioned Facebook. In the Philippines, penetration of Facebook is really, really high, same as in Indonesia. So we used this, and this was our battleground in terms of trying to get the public aware and to support the sin tax. The focus, of course, was on health, and we made sure that we would not fall into the trap of talking about economics, because then we would give ammunition to the tobacco industry. Of course, we would win that argument also, but it'd be much harder. So this was one of the themes of the campaign. Sin tax is an anti-cancer tax. And of course, if a senator was anti-sin tax, then he would label himself as anti-health. We also developed various other infographics to make it simple to understand, get all the figures out there, how many deaths a year. Actually, we count per day. That's 10 Filipinos per hour dying from tobacco. plus comparing the cost of cigarettes. In the Philippines, uh, this is about 50, 60 cents a pack, compared to our neighbors, Malaysia and Singapore. And then our epidemiologists, our doctors would speak also on behalf of the health community, talking about NCDs and why the sin tax is needed. So this is also in Congress. So one of the huge factors then for moving this forward was getting the doctors involved. The lower right picture shows some of the doctors plus the cancer victims thumbing down a report by one of the senators who was supporting the tobacco industry version of the tax reform. And this was really important to get the public aware that there are congressmen who were anti-public, not for the common good. This is our cancer champion. So he's got laryngeal cancer, speaking with an electrolarynx, and behind him are other laryngeal cancer survivors. So this was a huge statement, just being present during the public hearings. We got the youth mobilized, okay? Boy Scouts from outside of Metro Manila, traveling 8 hours to come to Congress, and standing with the pro-tobacco senator. And then there was even a marathon, a 16K run for the sin tax. 16K because 16 years of lobbying in Congress. Because of 16 years also of an anomalous sin tax structure. But at the end of the day, political support was the most important factor. Our 2-pack-a-day smoking president supported the sin tax because his platform was reform, government, good governance reform. And so he said, this is something we need to do, and it went through. We actually had to lobby for changing of the guards in Congress, so both in the lower house and in the Senate. The chairmen of the Ways and Means committees were replaced. In the lower house, there was a change of guard. In the upper house, the senator resigned from his chairmanship because of pressure from the public. And then there was support also from the lower government levels, and that really helped push the reform through. So I'll end with a couple of slides. Just very quickly, I hope I demonstrated clearly the level of opposition to the sin tax, and also the benefit of the sin tax revenues going towards health. And this is something I think that addresses the cost effectiveness of the measure, plus also the low resources that are usually allocated for cancer and other health programs. As Mike mentioned, this is a low-cost intervention, but at the same time, it's also very rewarding to see that we can actually have a source that goes into health. The Guam example is really geared towards cancer. The Philippine example is for universal health coverage, which would also cover NCDs. And just on that note, the recently adopted social development goals, the agenda for 2030, has the FCTC implementation as one of the target strategies, but it also is underpinned by the Addis Ababa Action Plan, which was adopted in July this year. And that also identified tobacco taxation as a potential resource for funding NCDs and other health measures in the years ahead. So just a couple of other short stories. Here is the headline after Cambodia, another low-income country, passed its tobacco control law. And this was after almost a decade of it sitting in Parliament. Okay? And the reason for this was tobacco companies lobbied very hard, and some of these senators who were in Parliament had relatives who owned tobacco companies. And it never budged. It never budged. It only moved this year because the Prime Minister quit smoking after 14 years of attempts to quit smoking. He finally quit, and he said, well, we really need to do something about smoking. And it moved forward. And I think this shows that even though we have the evidence, even though we have people who are guided by, what's in the FCTC and what's in Empower, at the end of the day, you do need political champions to push this through. And the other policy I want to mention here is also from the Philippines, which is a policy that was passed by our Civil Service Commission. I don't know what the equivalent is in the US, but our Civil Service Commission covers all civil servants, all those who are not elected into office. And this is a joint circular that was issued together with the Department of Health. And it simply says that we need to implement the FCTC's general obligation of protecting public health policy from interference by the tobacco industry. So this means no partnerships, no funding, not even the pretense of a partnership. You can't have your picture taken with a tobacco company, for example. So it sets very clear guidelines on conflicts of interest and the like. And this happened simply because we did a regional workshop on this particular issue, and one of our participants was a commissioner from the Civil Service Commission. She came back to the Philippines. She drafted a circular saying there's no smoking in all government offices. We want a healthy workforce. And then in the following year, they came up with this circular to guide government officials on how to behave with the tobacco industry. And this has been really, really good because in budget hearings, the pro-tobacco congressmen have actually challenged the Civil Service Commission to say, there's no basis for that. Why don't you recall this particular regulation? And of course, that to us sounds like the tobacco industry screaming. It's past the scream test of the tobacco industry. And for us, to hear that means it's an effective regulation. And we hope that over the coming years, there will be more and more ways for us to denormalize the tobacco industry so that it's no longer a safe or fair way of doing business anywhere in the world, particularly in low and middle income countries. So I'll end with that, and I think Stella will speak more about the tobacco industry in her presentation as well. Thank you.